efficiency of a system is seen in crisis. Good afternoon, everyone. Today I am here to speak on the topic healthcare system of India. The Indian healthcare system is a very vast and a complex one, and its origin goes back to 1947 with the development of Ministry of Health with the independence of India from British. Since then onwards, the health was made a priority in the 5-year plans. The National Health Policy of 1983, the Universally Healthcare Coverage of 2000 and the National Rural Coverage Act of 2005 have put India on a global level in the healthcare system. As we see, the statistics data of 2020 and 21, India had given 1.8% of its GDP towards the healthcare sector. That is 0.4% more as compared to the 2015 and 16 data. But if we see the developed countries like USA, they have put 19.7% of their GDP, and other developed countries like France, Switzerland, Japan has given more than 10%. Even our neighboring countries like Bangladesh and Pakistan have invested more than 3% of their GDP in the healthcare sector. But as we see that the healthcare sector of India is a bit complex one, and it is a 4-tiered system coming from national, state, district and block level. The issues regarding the technology and the security of the healthcare system goes to the nation, whereas the healthcare facilities and health studies and education goes to the state level governments. The state government is completely responsible for the healthcare system of its state. And as we see the problems faced by the healthcare system, we get to know that there is a difference between the availability of the facilities in the rural and urban areas. We see the general problems faced by the rural areas can be the lack of physician or the lack of basic amenities. But if we go to the urban cities, urban areas, we get to know that the high rate or the inflation in the areas in the terms of the public sector remain the case. But as we see, the public healthcare facilities are also doing their part, but that remains quite unproportioned for the low and middle class people, as the rates are quite high. Yes, we can say that we are the private healthcare sectors or the facilities are providing us the facilities at the fraction of what it is given in the developed countries, but still it remains quite out of the range of the basic normal human being of India. But as we see the COVID-19 pandemic, India's healthcare system had worked in a very efficient way, and after the second wave of COVID-19, we have seen there is a great improvement in the healthcare system of India too. As we see, there were 5.5 lakh cases of death in India, whereas in the developed country like USA, the death toll rose up to 10 lakhs, and that is shown how efficient our government was there in the dealing with the healthcare sector when it comes to the need of the citizen. To conclude, I would like to say that the Ministry of Defense and the healthcare system is quite in the right hands, and we should focus more on the healthcare system of India if required whenever our country is in need. Thank you.